So hello everybody, and thank you, Bushtan, for this introduction and giving me the space and the possibility, the opportunity to present a little aspect of the preconception health and care on today's event. So I'm going to speak about the preconception healthcare and focus more later on the recommendations for midwifery education. So before I begin with some definitions, just a brief overview what I'm going to speak about. So I'm going to introduce some definitions of the preconception healthcare. I'm going to outline what are the positive effects of it, and then briefly present those areas of preconception health that weren't talked about that much recently, and then present the role of the preconception health promoters and outline some recommendations for education, or if you want, midwifery education. So when speaking about preconception health and care, there are several definitions from different bodies all over the world. So for example, the CDC is actually talking about the preconception health as the health that focuses on taking steps now to protect the health of the baby in the future. And it recognizes it is very important for both women and men, whether or not they want to have a baby at some point in their life. And then the NHS says it is an opportunity for the woman and her partner to improve the health before they start again trying to have a baby. The ACOG says it is a set of interventions that sort of aim to identify and modify certain risks to the woman's health or pregnancy. And the WHO says it is a provision of biomedical, behavioral, and social health interventions for women and couples before the actual conception occurs. So we could also talk about other definitions. These are just a few. And what I would like to emphasize here is that we should bear in mind, we shouldn't talk just about the family planning, and we should discuss here, is it only just about family planning and how this is covered under those definitions? And I'm going to come back to this question later on in a few minutes. So when researching what are the positive effects of the preconception health and care, why is it so important? We can see that the WHO outlined several positive effects, and there are some of them listed here. So you can see it reduces the maternal and child mortality, it prevents unintended pregnancy, it prevents complications during pregnancy and delivery, it prevents stillbirths, preterm births, and low birth weight, it prevents birth defects, neonatal infections, underweight, etc., etc. But what we have to bear in mind here is that it doesn't solely focus on the pregnancy and childbirth itself. Or if we put it differently, on the pregnant mother and her baby, but we have to talk about the greater impact it has on the conception itself and on the fertility of the couple. So if we speak when it is the appropriate time to intervene or to promote it, I really like this diagram of WHO outlined in 2012, but it says when to intervene. So it clearly, you can see that they're trying to say that preconception and pregnancy is a topic we should deal with in the adolescence and in the part of the adulthood, which actually kind of represents the reproductive years of a couple. But when we are talking about the promotion of it, the promotion of the preconception health, I think we have to see the wider picture. So I think this arrow should go round and round like this. And not even that, it doesn't actually end, because there are certain factors that are influencing on the individual's life scale directly or indirectly. And of course, with the pregnancy and the new life being born, this circle goes on and on and on. So we should be aware that we should emphasize the preconception health in all the areas of the lifehood. And if we move on, of course, speaking from the position of being a midwife, midwives are actually health professionals that are already recognized by the ICM, which, for those of you who don't know, stands for the International Confederation of Midwives, as promoters of the preconception healthcare. Competencies for midwifery practice that have been updated from the ICM and published in 2019 clearly say that midwife is a professional dealing with pre-pregnancy period. However, midwives are sort of a promoters of preconception health and care, but the emphasis of those competencies was actually more on the family planning. And we've been talking about not just family planning, but also we now have to focus on the wider topic of promotion of the preconception health and care. So I didn't know how to put it, but I thought, okay, maybe it would be good to present to you this with an image of iceberg. And sorry, here it is. So the preconception health and care for me is at the moment as an iceberg. So you all know that the iceberg, you can only see one part of it. And usually they say, okay, you can only see 1/8 of it. And the 7/8 are somewhere under the water, hidden, and so on. So what we've been doing also in the education is we've been quite successfully dealing with issues of family planning, with contraceptives, with unplanned pregnancies, and of course, sexually transmitted infections. And we should not neglect those issues, but we should also include the other aspect, the hidden aspect of the preconception healthcare in the education, in our curriculums, etc. And this is the fertility awareness and health. And to name just a few factors here that were also investigated in very detail under this PreconNet project, these are all the factors that also influence the fertility awareness itself. So the environmental factors, nutrition, the tobacco use, the fertility indicators, the age itself, which is obviously increasing, use of medication, sexuality, and then vaccination, mental disorders, physical activity, sleep, and we could of course continue here. So please bear in mind, preconception health is really an iceberg, and it's about time now to start focusing on this bottom part of it. The preconception health and care promoters, of course, I've been briefly talking about midwives because I'm a midwife and I know the competences for midwives, but there are also other health profiles, of course, nurses and other health related profiles that have to deal with this very important issue now. Of course, to be able to promote the preconception health, we first have to think, how will we equip the individuals with appropriate knowledge? So how to equip the professionals with knowledge about the preconception health. For example, let's say the sex education of youth. In the past, this was merely oriented in the prevention of unplanned pregnancies, so contraception or prevention of sexually transmitted infections. But nowadays we have to think about how to introduce those people, so adolescents, for example, the knowledge how consuming alcohol may impact their future capability of having children. And at the moment, the European directives for nursing and midwifery education do not recommend, do not see the importance of the preconception health and care as such, because they're more oriented on the family planning. And also, under the PreconNet project, a deeper analysis has been done at the beginning of the study programs, actually, that showed there is no or very little about preconception health and care in the midwifery programs. And even if there were some aspects of it in the study programs, this was very fragmented and not presented as a whole. So to move on to recommendations for midwifery education, it is very necessary to think about the upgrade of study programs to be able to prepare the new graduates about the future role of preconception health promoters. So the emphasis has to be on preconception health and not just the upper part of the iceberg, but also the lower segment. And within the PreconNet project, we've been really aiming to create a model of preconception health and care for educators and community. And with the colleagues from the midwifery department, we are already trying to actually implement this preconception health as a separate module in the midwifery curriculum. And I really hope we will be successful. So to conclude, I would really like to invite you again to have a look at our website. There is updated and evidence-based information that has been thoroughly really collected for health professionals to get all the necessary information regarding the preconception health and care in one place. So yes, please have a look at it. And actually my message for you to take home today is that if we want health professionals to be the promoters of the preconception health, we really have to equip them with appropriate knowledge. And again, think about the whole iceberg, not just the upper part. Thank you very much. This would be all from my side. I really hope there are some questions. I'm happy if we have some minutes more.
Of course, if there are any questions, please just ask.
I provided also my email, so in case you figure of some questions later on, you can email me. I'll try to respond as soon as possible.
Okay, maybe we can change this iceberg to ice cream. What do you think? A joke. Okay, Petra, thank you for your nice and excellent presentation. I hope that the educators in the future will be more aware about these problems and especially understand what do you mean by this iceberg. Okay.
Thank you, Christian.
A lot of things are hidden and still have to emerge in the future. Now, you know, thank you, Petra.